What is selenium? Selenium is a mineral found in soil, water, and some foods. It is important for making many body processes work correctly. Most of the selenium in the body comes from the diet. The amount of selenium in food depends on where it is grown or raised. Crab, liver, fish, poultry, and wheat are generally good selenium sources. The amount of selenium in soils varies a lot around the world, which means that the foods grown in these soils also have differing selenium levels. In the U.S., the eastern coastal plain and the Pacific Northwest have the lowest selenium levels. People in these regions naturally take in about 60 to 90 micrograms of selenium per day from their diet. Although this amount of selenium is adequate, it is below the average daily intake in the U.S., which is 125 micrograms. Selenium is used for diseases of the heart and blood vessels, including stroke, hardening of the arteries, atherosclerosis, complications from statin drugs, abnormal cholesterol levels, and high blood pressure during pregnancy. It is also used for various cancers including cancer of the prostate, colon and rectum, stomach, esophagus, lung, ovaries, bladder, and skin. Selenium is also used for alcohol-related liver disease, asthma, eczema, enlarged prostate, liver disease, hepatitis C, diabetes, Cushing-Beck disease, low birth weight, muscular dystrophy, pancreas infection, swelling after surgery, itchy and scaly skin, psoriasis, selenium deficiency, blood infection, inflammatory bowel disease, Cauchon disease, and Osgood-Schlatter disease. Some people take selenium by mouth for underactive thyroid, thyroid inflammation, osteoarthritis, rheumatoid arthritis, RA, an eye disease called macular degeneration, hay fever, infertility, cataracts, gray hair, abnormal pap smears, chronic fatigue syndrome, CFS, mood disorders, arsenic and mercury poisoning, and preventing miscarriage. Selenium is also taken by mouth for preventing serious complications and death from critical illnesses such as head injury and burns. It is also used for preventing bird flu, swine flu, treating HIV/AIDS, and reducing side effects from cancer chemotherapy and radiation. Selenium is given through and for when someone has experienced a trauma and is critically ill. How does it work? Selenium is important for making many body processes work correctly. It seems to increase the action of antioxidants. Side effects of selenium. Selenium is likely safe for most people when taken by mouth in doses less than 400 micrograms daily, short term. Selenium is possibly unsafe when taken by mouth in high doses or for long term. Taking doses above 400 micrograms can increase the risk of developing selenium toxicity. Taking lower doses long-term can increase the risk of developing diabetes. High doses of selenium can cause significant side effects including nausea, vomiting, nail changes, loss of energy, and irritability. Poisoning from long-term use is similar to arsenic poisoning, with symptoms including hair loss, white horizontal streaking on fingernails, nail inflammation, fatigue, irritability, nausea, vomiting, garlic breath odor, and a metallic taste. Selenium can also cause muscle tenderness, tremor, lightheadedness, facial flushing, blood clotting problems, liver and kidney problems, and other side effects. Dosing. The following doses have been studied in scientific research. Adults. By mouth. U.S. Recommended dietary allowance, RDA, 55 micrograms for males and females, 60 micrograms for pregnant females, 70 micrograms for breastfeeding females. Currently, doses below the tolerable upper intake level, 400 micrograms, may be used in supplementation. Autoimmune thyroiditis, Hashimoto's thyroiditis, 200 micrograms daily. Abnormal cholesterol levels, 100 to 200 micrograms daily of a specific selenium product, Selenio Precise, Pharma Nor, Denmark, has been used for 6 months. By 4. Blood infection, sepsis, Sodium selenite has been given in varying doses, 100 to 4,000 micrograms by 4 daily for up to 28 days. Most treatments have included a loading dose followed by reduced maintenance doses. Children. By mouth. U.S. Recommended dietary allowance, RDA, 15 micrograms for those 0 to 6 months old, 20 micrograms daily for those 6 to 12 months old, 20 micrograms for those 1 to 3 years old, 30 micrograms for those 4 to 8 years old, 40 micrograms for those 9 to 13 years old, and 55 micrograms for those 14 to 18 years old. Adequate intake for infants up to 6 months old may be 2.1 micrograms/kg daily, and for infants 7 to 12 months, it may be 2.2 micrograms/kg daily. Maximum daily dose, 45 micrograms for those 0 to 6 months old, 60 micrograms for those 7 to 12 months old, 90 micrograms for those 1 to 3 years old, 150 micrograms for those 4 to 8 years old, and 280 micrograms for those 9 to 13 years old. Blood infection, sepsis, selenium has been given with zinc and glutamate along with metoclopramide by 4. Age-specific daily selenium doses include 1 to 3 years equals 40 micrograms, 3 to 5 years equals 100 micrograms, 5 to 12 years equals 200 micrograms, adolescents 400 micrograms. Uses and effectiveness. Likely effective for selenium deficiency. Taking selenium by mouth is effective for preventing selenium deficiency. Possibly effective for autoimmune thyroiditis, Hashimoto's thyroiditis. Research shows that taking 200 micrograms of selenium daily along with thyroid hormone might decrease antibodies in the body that contribute to this condition. Selenium might also help improve mood and general feelings of well-being in people with this condition. Selenium also seems to improve quality of life in people with this condition. Taking selenium doses under 200 micrograms daily might not be as effective, and it might be more beneficial in people with more severe cases. Abnormal cholesterol levels. Some research shows that taking a 100 to 200 micrograms of a specific selenium supplement, Seleno Precise, Pharma Nor, Denmark, daily for 6 months can modestly reduce cholesterol levels. Many people in this study had low levels of selenium in their body before the start of the study. It is not clear if taking extra selenium would have any benefit on cholesterol levels in people with normal selenium levels in the body. Blood infection, sepsis. Research shows that giving selenium along with other nutrients intravenously reduces the risk of death by 11% to 27% in people with a life-threatening blood infection called sepsis. But it does not seem to reduce the recovery time in the hospital or the risk of pneumonia or kidney failure. Special precautions and warnings. Children, selenium is possibly safe when taken by mouth appropriately. Selenium seems to be safe when used in the short term in doses below 45 micrograms daily for infants up to age 6 months, 60 micrograms daily for infants 7 to 12 months, 90 micrograms daily for children 1 to 3 years, 150 micrograms daily for children 4 to 8 years, 280 micrograms daily for children 9 to 13 years, and 400 micrograms daily for children age 14 years and older. Pregnancy and breastfeeding. Selenium use is possibly safe during pregnancy and breastfeeding when used short-term in amounts that are not above 400 micrograms daily. Selenium is possibly unsafe in pregnancy and breastfeeding when taken by mouth in doses above 400 micrograms daily, as this might cause toxicity, and in HIV-positive women, as this might increase virus levels in breast milk. Autoimmune diseases. Selenium might stimulate the immune system. In theory, selenium might make autoimmune disease worse by stimulating the activity of the disease. People with autoimmune diseases such as multiple sclerosis, systemic lupus erythematosus, SLE, rheumatoid arthritis, RA, and others should avoid taking selenium supplements. Hemodialysis. Blood levels of selenium can be low in people undergoing hemodialysis. Using a dialysis solution with selenium might increase selenium levels, but selenium supplementation might be needed for some people. Underactive thyroid, hypothyroidism. Taking selenium can worsen hypothyroidism, especially in people with iodine deficiency. In this case, you should take iodine along with selenium. Check with your healthcare provider. Fertility problems in men. Selenium might decrease the ability of sperm to move, which could reduce fertility. If you are trying to father a child, don't take selenium supplements. Skin cancer. Long-term use of selenium supplements might slightly increase the risk of skin cancer recurrence, but this is controversial. Until more is known about the possible increase in skin cancer risk, avoid long-term use of selenium supplements if you have ever had skin cancer. Surgery. Selenium might increase the risk of bleeding during and after surgery. Stop taking selenium at least 2 weeks before a scheduled surgery. Interactions. Medications that decrease the immune system. Immunosuppressants interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Selenium might stimulate the immune system. By stimulating the immune system, selenium might decrease the effectiveness of medications that decrease the immune system. Some medications that decrease the immune system include azathioprine, Imuran, basiliximab, Simulect, cyclosporin, Neoral, Sandimmune, Declizumab, Xenopax, Muromonab CD3, OKT3, Orthoclone OKT3, mycophenolate, Cellcept, Tacrolimus, FK506, Prograf, Sirolimus, Rapamune, Prednisone, Deltazone, Orasone, and other corticosteroids, glucocorticoids. Medications that slow blood clotting, anticoagulant, antiplatelet drugs interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Selenium might slow blood clotting. Taking selenium along with medications that also slow blood clotting might increase the chances of bruising and bleeding. Some medications that slow blood clotting include aspirin, clopidogrel, Plavix, dalteparin, Fragmin, enoxaparin, Lovenox, heparin, ticlopidine, Teclid, warfarin, Coumadin, and others. Medications used for lowering cholesterol, statins interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Taking selenium, beta-carotene, vitamin C, and vitamin E together might decrease the effectiveness of some medications used for lowering cholesterol. It is not known if selenium alone decreases the effectiveness of medications used for lowering cholesterol. Some medications used for lowering cholesterol include atorvastatin, Lipitor, fluvastatin, Lescol, lovastatin, Mevacor, and pravastatin, Pravachol. Niacin. Interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Taking selenium along with vitamin E, vitamin C, and beta-carotene might decrease some of the beneficial effects of niacin. Niacin can increase levels of good cholesterol. Taking selenium along with these other vitamins might decrease how well niacin works for increasing good cholesterol. Sedative medications, barbiturates interaction rating, moderate. Be cautious with this combination. Talk with your health provider. The body breaks down medications to get rid of them. Selenium might slow how fast the body breaks down sedative medications, barbiturates. Taking selenium with these medications might increase the effects and side effects of these medications. Warfarin, Coumadin interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Selenium might thin the blood. Selenium might also increase the effects of warfarin in the body. Taking selenium along with warfarin might increase the chances of bruising and bleeding. Birth control pills, contraceptive drugs interaction rating, minor. Be cautious with this combination. Talk with your health provider. Some research shows that women who take birth control pills might have increased blood levels of selenium. However, other research shows no change in selenium levels in women who take birth control pills. There isn't enough information to know if there is an important interaction between birth control pills and selenium. Some birth control pills include ethinylestradiol and levonorgestrel, triphasal, ethinylestradiol and norethindrone, orthonovum 135, orthonovum 7/7/7, and others. Gold salts interaction rating, minor. Be cautious with this combination. Talk with your health provider. Gold salts bind to selenium and decrease selenium in parts of the body. This might decrease the normal activity of selenium, possibly resulting in symptoms of selenium deficiency. Gold salts include uralthioglucose, solganal, gold sodium thiomalate, oralate, and auranofin, Radara.